and welcome to My Help My Mississippi, where we are providing you some great information that you can grab on the run right here at WMPR 90.1. I'm so grateful, so happy to have some guests here with me today. We are always going to be talking about my better health, mind, body, and medicine. So, guys, get your pencil, get your papers ready. Again, if you're driving, hold on to the steering wheel. You can go back and listen to this on YouTube. If you go to Charles and the Fighters, Fighters stand for Future in Great Health Today, Every Day, Responsible Self. You know what? Because we are responsible for our health, right? But we got to fight for it. Tell people all the time, good health just not going to come to you. You got to go and get it. Well, this morning we're going to give you some ideas of how you can be involved in the community. You got to be your mind, your body, and your food, right? We're going to make sure we bring it all to you. And that's what we're about right here at My Help My Mississippi. Well, I don't want you to sit where you are and not hear from my wonderful guest this morning. I want to let them introduce themselves. So, Jack, I'm going to start with you. Tell people who you are, where you're from, what you do, how you do it, when you do it.
Exactly. Well, Mrs. Smith, thank you so much for having us here this morning at My Health Mississippi, My Health, My Mississippi. My name is Jackie German, and I am with the Jackson Heart Study Community Engagement Center. I guess officially you could say my title is Program Director, but I like to refer to myself as the people's person.
The people person, getting folks engaged, right?
Exactly.
Yes. Okay, Warren, tell people who you are, where you
My name
from,
is
what you
Warren.
do, how
My name
you
is
do
Warren
it.
Jones, originally from Los Angeles, California. Currently residing here in Jackson. I work for the Institute for the Advancement of Minority Health as an epidemiologist. So I primarily work with our men's health program, doing data collection, and of course, community engagement and outreach.
That is so interesting. I can't wait to dive into that because we have something that's going to be taking place in the city. But man, when you're talking about, reaching men, we just got to have all hands on deck, all boots on the ground. We just got to make sure we make it happen, right? And
Exactly.
so I want to make sure that you understand that anytime you have something going on for the man, we want you right here talking about it, because whether you are a man anywhere in the city of Jackson or state of Mississippi or around the world, we need you to be involved. Make sense?
Exactly.
Absolutely. Well, again, thank you for being a part of My Help My Mississippi. Listen, there are some things that's going to be taking place, but right now, Jackie, tell us about how important is it though for us to be in the community? You always talk about our health, right? Because our health is our wealth. And one thing you're going to always hear me say is high blood pressure is not mandatory. It's not. Uh, uh, type 2 diabetes is not mandatory. High cholesterol is not mandatory. We don't have to have that all of our life, die with it. Now, if you're on your medication, please continue to take your medication. But action is required, okay? And if you can go and be fed information in the communities, we got to go get it, right?
That's right.
Because I always say, feed your body, but feed your mind, and you need to do it all the time. So if there's something in the community that we need to hear about, listen, we got to go get that, right? If it's going to be a different maker, a change maker in our life, we got to go get it. Look, we buy our prescriptions, we read the direction, we follow them to a T. That's the plan of the doctor.
Mm.
It's okay to have a plan of health on your own where you can have better health without any side effects. Okay. Again, continue to take medication. That's what we want you to do. But I also want to make sure that you have a plan for your health where you're doing some things that's going to better you. Because don't nobody love you like who? You love you. We should have said that together.
That's right. That's right. That's right.
That's right. So tell us a little bit about some of the things that you have done in the community, things that you've seen in the community, Jackie, and how important is it for us as people to be involved in the community?
Sure. So I'm glad you mentioned having the plan, and I'm going to back us up for a little bit because I never want to take for granted that people understand what the Jackson Heart Study is. And a lot of times when I'm in the community and I'm talking about the Jackson Heart Study, even though it's been around for over 20 years, and we're going to be celebrating our 25th year, there's still people in the state of Mississippi, as well as in the U.S., that still do not know about the Jackson Heart Study. So if you allow me just for a minute to talk about the study, and then we'll talk about some events we have coming up.
Absolutely.
So the Jackson Heart Study is one of the largest and oldest studies that looks at why do African Americans suffer more or disproportionately from heart disease than any other group. It was inaugurated back in 1998, and we are funded by the National Institutes of Health, specifically the National Heart, Lung, and Blood Institute and the National Institute of Minority Health Disparities. And so there are several collaborating institutions or centers that make up the Jackson Heart Study. Myself, I'm with the Health Department, Mississippi State Department of Health, with the Community Engagement Center. We have Jackson State University that has one of the graduate training and education centers, and I'll talk about what those are.
Okay.
We also have the University of Mississippi Medical Center, UMMC, with the graduate training and education center. And then, of course, we have Tougaloo College, who has an undergraduate training and education center. And we refer to those centers as GTEX and UTEX because one of the pillars of the Jackson Heart Study is to make sure that we are providing opportunities for our young folks, our graduate students and our undergraduate students to understand what are some careers in biomedical research and the biomedical sciences. And of course, with me being part of the health department, opening them up and broadening their perspective in terms of public health, because we know that medicine and public health work hand in hand, and there is a difference in the two.
Yes.
One of the things with public health that I think I am very passionate about and most excited about is that we get to treat whole communities, so to speak.
Whole communities.
Whole communities.
I love it.
What we call population-based health. So we're concerned about, smoke-free air ordinances. We're concerned about making sure that there are parks and places for people to have access to physical activity. And those are just some of the things when we talk about a population level type health versus just medicine, where you have a doctor-patient relationship. Now, they must work hand in hand because we need for doctors to understand that in order for people to be healthy when they come in, a lot of times it's just simply things that are happening in their environment, like environmental issues, whether or not there are access to physical activity. I mentioned parks, but also are the streets designed for people to be able to exercise and bike?
Yeah.
And then, doctors sometimes may encounter a family member, a mother and her child that may be suffering from asthma. But what they may not understand is that they may be living in a condition where there's rodents and roaches that cause or create the problem or keep the problem there. And that may be a problem that may be beyond the person's ability to respond to, because they're depending on, someone else in terms of a apartment setting to kind of help with their health. So therefore, health becomes environmental in that perspective.
Right.
So those are the kind of things that we get involved with, in public health. And that's just one piece of public health. Public health is a lot of things. People know us, from the West Nile virus and Ebola and treating those things. And also when we have tornadoes and storms that come through, the whole emergency perspective. So it's really important that we train our graduate students, our undergraduate students about understanding the whole perspective of health. Health is where you live, work, worship, and play. So I just want people
Say that again.
Health is where you live, work, worship, and play. So everywhere people gather, everywhere people live, everywhere people exist, it's called health in all policies, So there is health measures or health implications for wherever people reside, wherever people gather, wherever people congregate, wherever people engage. And so that's what that's another concept, health in all policies. So I just want to be clear that our audience understands the significance of the Jackson Heart Study and its historical perspective. I like to say the Jackson Heart Study is not only Mississippi history, it's American history and it's world history. People know about the Framingham study. That's a study that's been around for a lot of years too, like the Jackson Heart, longer than the Jackson Heart Study, that looks at, our Caucasian sisters and brothers and the risk factors and everything for heart disease within that population. But the Jackson Heart Study, helps us to understand why folks that look like us are suffering at an alarming rate or disproportionate rate or more than other groups. That is not to say that other groups do not have challenges.
Right.
But when you have one group that kind of deals with it in a little different or larger platform per se, then it's important for us to understand, because if we can lift that boat, if we can take on that challenge, then we help everybody else. So, we do need to look at, I know there's a lot of, things that people are reevaluating now in terms of health and things like that. But it is important to focus on groups that may suffer more than others, because that's really, really important to the work that we do in public health and in medicine and in science. So with that said, before I let Warren jump in, we do have some activities coming up. The one that I want to talk about that's coming up very soon in June is called Man Cave. But before we talk about Man Cave, I know one of the things that we also want to talk about was how can people stay connected and stay involved in their communities. And so there's a group that's also going to be part of the conference called Community Health Advisor Networks, CHANS. And I've been so privileged to have you to come out and meet with our CHANS, talk with our CHANS, share the very important information about plant-based living that you present so well, and we're just grateful for. And those community health advisor networks have been around with the Jackson Heart Study for a very long time. We go into communities and we work with community volunteers. Some of them may be members of the Jackson Heart Study cohort, but many of them are just folks who are in these municipalities, in these towns, in these cities, who have a heart for their community and want to make sure that they are involved and really helping their communities to be healthy. And so right now we have one in the Bolton Edwards area. We have one in the Clinton area. We have one in the Pearl area. We have one in the Jackson area, of course. And then we started some new ones in partnership with the Jackson Hines Library System in Utica, Raymond, and Terry. And so each month, on a consistent basis, we get together and we talk about various health topics. And those health topics are centered around national health observances. For example, this month, this is high blood pressure education and stroke month. And of course, in February, we talk about American Heart Month. And so we bring in presenters, we bring in speakers, folks who really have a heart for the community and understand, what are some of those challenges communities face with access, and try to bring that education and resources like yourself. For example, Mr. Smith, you came in and did some healthy cooking demonstrations and really showed them like the things that are right there locally that are grown in Mississippi that they have in their grocery stores, or with how they can take those different food items and have healthier choices, juicing some of those vegetables and some of those fruits and making them a healthy choice rather than some of these sugary beverages. Right.
Yes.
So that's just one example of something that has been sustained and ongoing for a long time. And we're constantly trying to promote people to come out and get involved and get active and empower themselves to be health advocates in their community. And so I won't talk about Man Cave yet, because I'll let Warren jump in here and talk a little bit about some of his activities too, and about the Institute.
Well, first of all, thank you for sharing so much with us. And wherever you are listening from, there are activities that are taking place in the community that we should be involved in. And because it's wherever we are getting our information from, we want to make sure that we are participating. If somebody's providing information for our health, like every city you name, these are some of these are small cities, but we're providing information.
That's right.
Valuable information. So in the small cities, the big cities, Warren, we're making sure that people are receiving the information that they can use to benefit themselves, right? And regardless of what state you're in, I know, Warren, you're from a different state, but now you're in Mississippi. You don't ever want to leave Mississippi, because once you come to Mississippi, it has that effect on you. But you can testify wherever you are, there are some things that's going on in the community, and we want people to kind of plug in, because the community, and I love the way you said that, Jacqueline, wherever you are, that's where your health and everything starts there in that community. And when they're teaching us about food, teaching us about different things, and I know I have totally enjoyed watching the expression on people's faces. And some of these were in the library, someone was at other
Mhm.
community centers. But the idea of the Jackson Heart Study, you know, making things happen like that. And let me just say this before we go to Warren, I've been a part of
That's
the
right.
Jackson
That's
Heart
right.
Study since and that's been years ago. I'm one of the original members, and I still gonna get my checkup and everything when they have it. So I totally enjoy and thank you for expressing what the Jackson Heart community the Heart Study has done for the community.
And I'm so glad you said that. I'm so glad you said that. Because when people were talking about you, you know, even before I knew what My Health, My Mississippi was about. And so when they said, well, you know, he was a member of the Jackson Heart Study cohort. I said, oh my God, how perfect can this be? And so when I was sharing with some of the folks that helped us to keep the Jackson Heart Study going, they were so excited. And they've actually started to, you know, they came and checked out your website. And so we were just really excited that someone who has been a part of the study is now taking it by the reins, not the study itself, but, you know, taking the whole community and wanting to do something great for the community, and put it out there and make the information sing, so to speak. Because you sing literally.
Sing is what it's all about.
That's right. That's right. So thank you for just being a part of the study and just taking this information in the community. This means a lot to the study itself.
Well, thank you so much. So, Warren, there's some things that's going to be taking place. Tell us about it. Well, again, we're excited to have you here. And first of all, how's Mississippi?
It's been good to me. Mississippi has been really good to me. I can say, I always tell folks I really feel like I became a man here. I'm actually wasn't when I was at Tougaloo, I didn't have a good enough GPA to join the undergraduate training and education center with the Jackson Heart Study, but I'm proud to say that I was able to become a member of the Jackson Heart Study Graduate Training and Education Center. So went through that program, didn't discover the field of public health until my last year at Tougaloo under the direction of Dr. Wendy White, who runs the undergraduate training and education center. So the first time I ever heard of epidemiology was an intro to epi class that I took with her. But when I, took the class, I was like, man, this is it. Everything just made sense and answered a lot of the questions that I had as far as, why health disparities exist in certain communities and what things are being done about it. And so I'm currently right now working on my DRPH at Jackson State. I was, like I said, I was able to join the Jackson Heart Study while working on my master's degree there. That's where Dr. Melvin discovered me, and I did a project with her during the pandemic, actually, where she ended up bringing me in and giving me an opportunity to start my career in public health. So
shout out to Dr. Sandra Melvin.
Sure. Of course, our founder and CEO of the Institute for the Advancement of Minority Health, and just extremely blessed to be able to meet her and work with her and be given an opportunity to start my career in this field. But to answer your question, Mississippi has been really great to me. Have been able to really create and build some lifelong friendships, and so I've just for that reason is why I've just been so passionate about giving back to this community that has given so much to me. So just really proud to be here and call it a second home for sure.
And so, Warren, thank you for being willing to give back, because that's so important. When you receive, for much is given, much is expected.
For
So we
sure.
want you to be able to give back. So thank you for, hanging around Mississippi, being able to give back, because, we need to be a blessing to the people who've served us.
That's right.
And that's why this show is called My Health, My Mississippi, because I'm making sure that everybody hear about us on WMPR 90.1, where we just have so much fun.
For sure.
So tell us about what's going on in the event that you are working on.
Of course. So this year, we're the Institute is hosting its third annual Black Men's Health Equity Conference, and this conference has been getting better every year. Last year, our keynote speaker was Yusef Salam from the Central Park Five, and so the conference is all centered around Black men and educating Black men about how to lead healthier lives. And so we have a Black Men's Health Equity Council at the Institute, which is all centered around just connecting that network of men who are doing work in men's health, whether that's prostate cancer, youth mentorship, tobacco prevention, HIV prevention, all of these different things that affect Black men's health. But it's also for the common man, the everyday man that may not be as educated, may not be as well versed around these things. And so it's just trying to create that network and build that network of brothers teaching brothers, brothers mentoring brothers, and just really just focusing on the Black man's self that sometimes gets forgotten about. Black men are sometimes always worried about providing and being, strong and all these different things. But, the mental health challenges that come along with it, the chronic illnesses, as you stated earlier, that have become just so common amongst our communities. We're just looking to dispel those things and introduce different methods and, just really educate on the importance of getting good rest. Eating healthy is something I know that you're very familiar with, and how that can not only impact the man as an individual, but also things that he can take home, to his family, to his friends, to his community, to help them lead better lives as well. And so this year, we're proud to announce that our keynote speaker for this year's conference is Roland Martin, who, as you may know, is an award-winning journalist, a media personality. And so we're planning for him to deliver a very, very powerful keynote message at this event. We'll have some of the most bright and brilliant men and women, scientists, public health practitioners, healthcare providers at this conference, touching on topics around men's sexual health, circulatory health, heart disease. We'll also be giving some panel discussions on financial literacy, how to invest, learning about stocks and things like that, to help, of course, financial things can be a burden sometimes that can create stress. So just really trying to think about the man, the Black man on holistically, and all the things that impact his health. So expecting for this year to be another great conference. Is going to be on August 23rd. That's a Saturday. Starts at 9 a.m. and 3 p.m. It'll be at Jackson State University Student Center. And like I said, we're looking for this to be another great conference, and it's absolutely free. You can register now at minority-institute.org. Again, that's minority-institute.org, and registration closes July 31st. So seats are filling up fast. Feel free to register. It's open to men ages 17 and up. So we want to, of course, men who are at risk for those chronic illnesses. But as Ms. German mentioned earlier, this whole initiative and this whole purpose is not just to educate the men who are at risk, but our theme this year is prevention, power, and progress. And the progress part of it is really touching on preventive health and the power that you can get from that, how you can know your status, be able to make healthier decisions by knowing those preventive steps. But the progress is passing that information on to the next generation and creating a new generation of health knowledge and health literacy to change that history of chronic illness within your family. So we're excited this year and just inviting all the brothers across Mississippi to come out.
Boy, that is, I love that. Prevention, power, progress.
Yes, sir.
That's awesome.
That is really awesome. I'm all about the prevention and something that you said, because we talking about all men, and I always say on this show, we're focused on better health, mind, body, and medicine, because it all kind of work together, right?
Yeah.
We need medicine, but we don't need medicine to be the primary thing that we're looking to, right? We need prevention. Can I get some prevention in the house today?
That's right.
I'm telling you, man. If I have high blood pressure, here's the deal. I want to take my blood pressure medication because that's dangerous not to.
Right.
Am I right?
For
But
sure.
can I not have high blood pressure? Can somebody give me the right not to have high blood pressure? Okay, everybody raise your right hand because I'm giving everybody right now not to have high blood pressure. All you got to do is go to work and make sure it happens. You got to exercise. You got to go out and get your mind fed, though, right? You got to listen to what people are. When we're putting on events like this or in your community, wherever they are, you got to get up and get out there and get some of this information. Am I right?
That's for sure.
You got to feed the mind,
That's
right?
right.
When the mind is growing, we gonna be okay.
Sure.
And to continue on with feeding the mind,
Mm-hmm.
and one of the reasons why I was really, really excited to work with the Institute for the Advancement of Minority Health, because they were doing this conference, and this is their third year, and they have a task force, that is composed of men looking at these issues. And so with our empowering community to a Healthy Mississippi conference, we're also referring to it as the Healthy Mississippi Conference. So if you Google empowering communities to a Healthy Mississippi or Healthy Mississippi Conference, being sponsored by the Mississippi State Department of Health in collaboration with the University of Southern Mississippi, you'll see a very powerful lineup that'll be full of all types of health education, health information, and looking at what people are doing across the state. And so as a precursor,
Mhm.
to this men's conference, we're going to be having a pre-conference there at the Empowering, and we're calling it Man Cave.
Okay.
And Man Cave is an acronym for Men Actively Nurturing Their Health, Connecting, Adding Value, and Elevating. And so when I knew about this men's conference through Warren's institution, I said, some kind of way we got to plug into that and keep the momentum going. So this will happen about a month or two before their conference in August. And so I want men out there to come out on June 2nd. And it's going to be held at the Sheraton Refuge Hotel, June 2nd, which is a Monday.
Mhm.
Why a Monday? Is because we do a lot of work with barbershops through an initiative called
Okay.
Brothers Reaching Out to help educate on routine screening. So it's our way of having barbers to understand the importance of their work, not only in just making men look and feel good, but also being a part of their health look,
Yeah, I like that.
so to speak. Because if you know a history about the barber pole, it's a medical symbol, actually.
Yes, a lot of information.
That's right. So barbers have naturally been in this space.
Mhm.
That's part of their origins, part of their roots.
Mhm.
And so we wanted to have this conference on a Monday because we wanted to allow barbers to be able to come out, because that's the day that they usually are off work.
Mhm.
And then we put it in the evening, and we did this in consultation with Warren and other men to really make sure that we did something that they would enjoy coming out to, and that would increase their attendance in numbers. So it's going to start at 5 p.m.
Okay.
at the Sheraton Refuge Hotel, which is the one that's located right there off of Airport Road. It's one of the newest Sheraton. It's a
Right.
beautiful building. And so it's going to be a very nice setting. And it's going to start with a little networking event. So at about 5 p.m., we'll get started with a little networking and light refreshments. And then we'll move into the agenda for that day. And we'll be serving dinner for the men. And to piggyback off what you'll see at the Institute's conference in August, we're also going to be talking about those topics too that are important to men that Warren mentioned: the sexual health, the mental health, and of course, being a part of the Jackson Heart Study, cardiovascular health.
Right.
We have a dynamic lineup of speakers. Dr. Turner, Justin Turner, a lot of people know.
Mhm.
Dr. Thomas Dobb, former state health officer. We've been told that Coach
Okay.
Ridley from Jackson State University, is going to come out and give some opening remarks. Dr. Moma, Dr. Reddix.
Okay.
Who else, Warren? Just a whole conglomerate of other
Dexter
people.
Mayberry will be there as well. He's very, very bright brother in those preventive health with dieting and different healthy recipes. So just a dynamic group. I would consider this some of the brightest minds in men's health in the state. And so we're just looking to continue to build that network. And this is, again, these events are free. And we're doing them at a time where we're hoping brothers will be available. And this is again, I know black men sometimes get forgotten about, and men's health may get overlooked. But remember, brothers, if you're hearing this right now, this is for you. Jackie and her team, she has an amazing team she's working with to plan this, and they are all focused on how can this best benefit you and your health. And we're planning for you to be able to leave there knowing how to be a healthier man, and also the networking the name she just mentioned, being able to meet some of these folks in person, build those networks, and be able to create some whether it's business opportunities or just friendships with some very, very, very bright brothers that you'll be able to reach out to and connect with. So it's going to be an amazing event. I'm really excited about it.
So when you go in the community, you can grow your own community by networking and all that good stuff. Yes. Well, we are going to take a break right now, and we on the other side of the break, we're going to do Who Am I, and we'll have some more great information from our guests. So hold on, don't move. We'll be right back.
Sure. Gotcha. Yeah, I'm actually gonna be.
Sir. Keep going. Keep going. Keep going. Keep going. There you go. Right there. You gotta get some of these young folks to help you with the mechanical and technical part. I just always ask them in my office, look, how do I oh, sorry.
All right, we are back, and again, I have Warren as my guest to the right, Jackie, my guest to my left. For those of you on the radio that can't see us, they are looking fabulous with great information that you can take on the run that'll change your life for the rest of your life. Wherever you are, we want to be there, and we have some people who are helping us to be where you are, like the Tabernacle Ministry. Thank you so much, Tabernacle Ministry, for thinking enough of My Help, My Mississippi to say, you know what? They doing a pretty darn good job over there at WMPR 90.1. We want to help support them. So thank y'all for wanting to be a part of what we are doing right here in the city. And before I get with back with my guest now, this portion of the show is called Who Am I? Here is a food, and I want you to let me know who am I. Now, this is an important food, but I will tell you this, so help you out if you're listening. It is a fruit, okay? There's four areas that I always want you to focus on for your health. And one of those areas are fruits. The other one is vegetables. The other one is grain and your legume, which are your beans and your peas, all right? So your beans and your peas, your grains, your vegetables, and your fruit. If you could eat as much of those as you want, right? You're gonna be okay, right? So this particular one is it's rich in nutrients. It's a good source of vitamins, especially vitamin B6 and C. Vitamin C now. Vitamins. How often do you need vitamin C? Every day. Why? Because it doesn't store in your body like your B and your D. And it's high in potassium and magnesium. And it has a lot of fiber. What do I say about fiber? Fiber is to the body what Drano is to a stopped up sink. Please get the fiber in your body. You need to be moving along regularly every day. It's amazing. And I'm going to have someone to talk to us, later on this year. But people don't go to the bathroom. Some of them once a week, twice a week. We need to do this every day.
Mm-hmm.
And here's how we can do it. Get the high fiber in our body. This particular fruit, again, is high in potassium. It helps regulate blood pressure. Men, women, children, help regulate blood pressure. Blood pressure is not required. It's just that we got to do something about it. And this particular food will help you do that. And Jack, it helps support heart function. Wow. What a fruit, man. I know you're wondering what it is. So give me a minute. It contains both soluble and insoluble fiber, which help promote regular bowel movements and improve gut health. Man, I need this. Energy booster. This natural sugar, glucose, provides a quick, sustained energy boost. Great before or after exercise. Who am I? Look, this particular fruit support kidney health. Wow, a moderate intake of this particular fruit can help support kidney function due to potassium, but people with kidney disease should monitor intake, okay? Here's another one. Help with mood and sleep. How many of y'all wow, you moody, you need some sleep? This food's gonna help you with both of them, right? So it helps with blood sugar control. Despite being sweet, this fruit has a low to medium glycemic index, especially when they're, not cooked, and they're high in fiber health. Weight management. I'm not talking about anybody, right? But weight management, their fiber content can promote fullness and reduce overall calorie intake. Listen, I'm telling you, I just be honest. I eat this fruit every day. 1, 2, 3, however many I want, right? Antioxidant properties. This particular fruit contains dopamine. Wow. Antioxidant that reduces damage from free radicals. Muscle function and cramps. You ever had cramps?
Oh, yeah.
Potassium and magnesium in this particular fruit help prevent muscle cramps and support muscle function. Tell me, what food am I talking about? Hello, bananas.
That's what I was going to say. I was going to say bananas. Yeah.
Hello, bananas. Look, something we can grab on the run.
That's right.
Enjoy.
Very
Don't
cheap
have to.
too,
Very
affordable.
inexpensive, right?
Very affordable.
The myth is that eating healthy is expensive. It's just that, a myth. It is not. The beans are so inexpensive, fruits, and when you can grab a banana every day or two every day, you can't tell. Well, I don't know how to cook, so I can't eat healthy. Well, bananas don't have to be cooked.
Yeah.
That is an alert. All right, bananas don't have to be cooked. Just grab them, and you can buy them from anywhere too, just about. And I like talking about foods you can get at any store. Some of even your service stations sell these because they
That's
want,
right.
So it's a very popular fruit. But this is what we need to make sure that we can stay healthy. Make sure that we're focused on us. It's okay to focus on our health. I tell people all the time, guys, there's nothing wrong with focusing on your health. Men, pick up a banana. When was the last time you had some fruits? Don't tell me last week, because I said earlier, vitamin C needs to be in the body when? Every day. So we need this in our body every day. Let me just say, I will be at an event. It's called National Seniors Health Fitness Day at the Ark. This is going to be Wednesday, this coming Wednesday, the 28th, from 10 to 1 p.m. I'll be doing a cooking demonstration over there. When I'm cooking, you don't want to miss it. I'm not bragging. I'm just saying I love my food, and whoever eat my food, love my food. I love cooking, but I pay close attention because I tell people all the time, I love good tasting food. Don't bring me
That's right.
don't bring me nasty food telling me it's healthy for me. You eat it. How many days are you gonna get up every day eating nasty food just because it's healthy? No, we can have it both ways.
That's
We
right.
can have healthy food and we can have good tasting food. I tell them, listen, it has to be good for me, but it has to be good for my body as well.
That's right.
If it's not good for my body, Warren, it's non-negotiable. I'm not going to go negotiate with my kidneys and my liver and say, look, guys, I know y'all are there, but I'm telling you, I'm gonna have to eat this food. It's not good for y'all, but it tastes good to me. Well, does that make sense? We need to be more intentional. I tell people all the time, our mouth is the door to the house where our liver and our lungs and our kidneys and our heart live. And we need to be careful who we let in our house because they mess with our organs. Called the 5 lives. Okay, you have 5 your main organs, and you have more.
That's right.
But your main organs are gonna be your brain. Can we pay? Oh, just saying that is that powerful? Come on now, don't neglect your brain by just letting anything into your mouth. Do not. You can't do that.
Mm-hmm.
Come on, your brain, right? That's why I say that one first. Your brain, and then your heart. Whew, when that baby stopped ticking, your heart, right? And then your liver, your lungs, your kidneys. These are your top 5 organs that are living in your system. And if you just allow anything to go into your system and don't pay any attention to it, don't even read the labels, that is disrespecting the lungs and the kidneys and all your organs when you just put stuff in your mouth. You don't even know what it is. Somebody advertised it and you go get it. Like they care about you. That old boss said, if you don't care about you, I mean, nobody loves me like I love me. So if you don't care about you, why should they care about you, right?
That's right.
So we need to pay attention to ourselves. And when I said the brain, and basically what my guests are talking about today is to make sure that we're filling our brains with the important information that's going to help us health-wise, right? So if we have an event in the community, wherever you are, if you're in Kentucky, Jane, if you're in Chicago, wherever you are, there's something going on in the community where you can be fed mentally. We need to be fed mentally. And I want to say this before I get back to my guest. I was at the Wood Center a couple of weeks ago. It's in Clinton. And oh man, it's a beautiful scene. You get a chance, go to my website or my Facebook page, where you can access that from my website, myhelpmymississippi.com. And I had the people put their hand over their heart, and they were just singing, Jackie. I don't know what I would do if it wasn't for you. Heart, I don't know what I would do if it weren't for you. I heard my wife singing that song. She had heard it on. She heard it on the on because the lady had posted it from the Wood Center, and all the folks at the Wood Center were in a circle and they were singing. Your heart is important to you.
That's right.
That's why I'm proud to be part of the Jackson Heart Association, because we need to make it easier on our heart. When we have our blood pressure, again, please take your medicine. But if we can prevent it, we don't have to have heart problems. If we don't have to have high blood pressure, then okay, then why? Just because mom and them had it? Okay, but now action is required. You can't just eat anything. Okay, you can't eat just any old kind of food. Okay, let me just say this. I'm not telling you what to eat or how to eat. I'm just bringing you some facts. And it doesn't matter where you are. Meat has 0 fiber. Those are just facts you need to know. Okay, now, so if you are eating meat, you need to eat something. You need to get your fiber from somewhere else. So this is why going in the community, listening to speakers, and I know Dexter will be talking about things like this. This is where going in the community, getting facts. So meat has 0 fiber. Nobody talked to us about that. Why? Simply because, I mean, come on, there are farmers who, they want to sell meat and they want to advertise meat, right? You don't hear people advertising broccoli on television. Ooh, you don't have broccoli cravings, right? You don't have, I need some Brussels sprouts. I'm just craving some Brussels sprouts. You don't have that. But the advertising that are in our head, but meat has 0 fiber. Here's something else that doesn't have fiber. Dairy product has zero fiber. Okay, zero. Here's something else that has zero fiber. Eggs has zero fiber. Now you can eat as many as you want, but what I'm telling you is, this is why you have to take Metamucil, whatever that thing is called, right? Because you're not getting enough fiber. I was doing a class this past Tuesday night, because I do free cooking classes online, showing people, and I have a doctor talking in the beginning, and they were talking about the American diet, which is the standard American diet. It's called the what? SAD diet, standard American diet. People are receiving every day around 10 grams of fiber. You know what's recommended? 40 grams. We're way off from that. How can we correct that? Very simple. Let's start getting some greens into our bloodstream. Let's start eating fruits every day. This is what I mean by going in the community, getting information, learning about some different ways that you can take care of yourself, right? My Health, My Mississippi. We're the fighters. Fighters stand for what? Future in great health today, every day, responsible self. So, Jackie, the community is important, and I love the way you put it.
And just to expand upon what you're saying, and getting in the community, the Jackson Heart Study in particular, Community Engagement Center, and when you reference the myths about food being or eating healthy being expensive, we do have to deal with some harsh realities about the accessibility of food. And unfortunately, in the economy now, people may be faced financially, with making choices, and especially in the communities that we serve and prioritize. And so, not only just food, but also medicine as well. People are making choices, between getting medications and eating. And so, and now with the price increase on everything, getting out in the community and learning about what's available to you, what's accessible to you, what are some low cost effective ways to still be able to maintain good health becomes really, really important. That's why I've always been grateful to you in supporting the CHANS, the Community Health Advocate Networks, because you really saw and continue to see the benefit of when people can't get all this health information from their physician because they may not have access to a physician because of lack of health insurance, which is another whole topic in itself. At least having a mechanism for people to be able to come and get regular, consistent, vetted, clear, accurate information becomes important. And so I appreciate you always wanting to promote the fact that we have these CHAN networks that meet on a monthly basis so people won't feel helpless, that they know that I may not be able to go to a doctor, I may not be able to necessarily access the healthcare system, but there is a group that meets every month in my community that's sharing this kind of information. And so if you are able to, this is another free event, those CHANs that I talked about, that in those different towns and cities that I mentioned early on, Bolton, Edwards, Clinton, Jackson, Pearl, and so forth. And you can also find a listing of the monthly calendar dates on the Jackson Heart Study Instagram, the Jackson Heart Study Twitter, and the Jackson Heart Study Facebook. We post a flyer each month of where those meetings are being held. So you can plug in. Sometimes the meeting dates may change, but we put a number on that flyer where you can call to make sure before you arrive that the meeting is still at the same place in the same location. But during the Empowering Conference, we're going to have a CHAN retreat. So you'll get a chance if you come out. That's going to be on June 4th. That's a Wednesday morning between the hours of 8 to 12. We'll serve breakfast too. And you can get connected with and meet a lot of the people who are part of these CHAN networks. So you don't have to be a member to come out to the CHAN retreat. That's also listed on the conference website. These pre-conferences, the Man Cave and the CHAN retreat, are on the Healthy Mississippi Healthy MS Conference website, or go to the health department's website. to get the details about all the pre-conferences and the times and availability, and also to register. But the Chan retreat is free and the man cave is free. So if you want to learn more about how to get plugged into your community on a monthly basis, volunteers, come out to the Chan retreat. That'll be a good first start to meet some of the other members, network, and then learn about what they're doing and how often they meet and where they meet. So I appreciate you talking about how to engage the community and how to sustain it, because we believe that this is one avenue where if you don't know where else to go, the Chans is a potential avenue. And we're not the only game in town. There are other groups who meet, but I'm with the Jackson Heart Studies. I want to make sure that people know what are some opportunities that exist to get involved on a community level.
So that's so important. So do be involved at community level, right? I even titled this program, community involvement. Listen, I will be at that particular Chan too on the 4th. It is a retreat, and this will be my second year speaking there as well. I just like to provide information that can make a difference in your life for the rest of your life. And for those who can't get the fresh vegetables, I always say, buy the vegetables in the can, buy the beans in the can, rinse those babies off, try and buy low sodium, rinse them off. It's an inexpensive way, and I like showing people how to do that because your health is your wealth. And look, the fiber don't need to stay in the can. It needs to be in you. So get them babies out that can, right? And then if you're going to use the dry beans, here's a tip: soak those babies overnight, right? I know people think, well, they're going to bloat my stomach, No, soak them overnight and then cook them well. Your beans need to be cooked very well. This will be very helpful for you, okay? And then if there are the smaller beans, which are your lentils, I show folks how to do a lentil soup, and I also came up with the recipes. Tuesday, a lentil cornbread. My wife loved it, and I'm going to be sending that out. So look, guys, let's go fight for our health. That's the way it should be. So Warren, as we wind down this hour, it seems like it goes so fast. When you have good information and you have good people all around you, like you guys are, time just flies, right? And again, I want to thank Tabernacle Ministry for helping us to bring this information on WMPR 90.1, number one station in the nation, to provide you with good, helpful information. So Warren, any final words that you would want to leave, particularly our men or in general?
Of course, yeah. Just to kind of add on to the points you all were making. When Dr. Melvin first assigned me to, run our men's health initiatives and our men's health council, I wasn't eating healthy. I wasn't getting adequate rest, and taking care of my mental health, and just a lot of things that I wasn't doing. And I didn't notice I wasn't doing these things until I began until I was tasked to educate others on the importance of it. So it made me have to first self-reflect and start taking care of my own health. So it's a lot of things I had to unlearn and relearn as far as rest and dieting is concerned. And so a lot of the things that we do every day is just, you talked about the American diet and just the American culture around healthy eating, or around just eating in general. And so, men, when you start your day, it's very, very important. Every morning I eat a large bowl of fruit, including bananas and all those things.
Come on with the bananas.
Kiwis, watermelon, cucumbers. Kiwis and watermelon are two of the fruit that are highest in water and in hydration. So hydrating your body is extremely important when you start the day like that. Berries are good for your brain and your synapses to think clearly and make clear decisions. Kiwis are a sleep inducer. You don't need a sleeping pill. You don't need any of these different things that they advertise. If you ever see something advertised on TV or any type of pill or anything like that, they're never, ever, ever going to tell you to eat healthy.
No.
They're always going to say, take the pill and everything is going to be okay. But there's all these different foods, and dieting and eating healthy and eating correctly helps you in that regard. And Take the time throughout the day, if you can, to get some physical activity. I work out daily now, and I started to do these things again because I wanted to first, before I educate others on it, to see if these things actually work, and they do. They have tremendous benefits, and even if you're doing a job where you're sitting down most of the day, you still need to strengthen your mind and body to be able to handle the rigors and the stressors that come with your work. So men, take care of yourself out there, get adequate rest. It doesn't happen overnight. Changing habits is difficult. So start, find a starting place and remember the benefits of it. If you're an older man, like I said, if you have a daughter, you want to be able to walk her down the aisle when that time comes. You want to be able to, walk with your son or play with them in the backyard, throw the football, walk them across the stage for graduation. And you will not be able to do that or make it to that point if you don't eat healthy and take care of yourself every day.
That is it, Warren. Don't just take the pills and pay the doctor bills. Eat the fruits and avoid all that stuff. Closing remark. We got 30 seconds,
Okay.
Jackie.
Empowering Communities, Man Cave, June 2nd, Sheraton Hotel. The rest of the conference dates are June 4th through June 6th.
Oh, for the Men's Health Equity Conference is going to be August 23rd. Jackson State University Student Center. Our guest speaker this year will be Mr. Roland Martin. Registration is live now at minority-institute.org, and it's absolutely free, and we hope to see you there.
And My Help My Mississippi every Thursday morning from 7 to 8. Make sure you tune in because you don't want to miss it. You can always reach me at myhelpmymississippi.com or 601-940-4940. We'll see you next week. Same time, same station. Thank y'all for being with us today. Have a great one.
Thank you.
Great show.
Thank you so much, Mrs. Smith.